At Norrlands sykehus in Bodø, a new nursing app was introduced. After some evaluation, the results showed that they neither saved money nor resources, so the implementation was a failure. Well, this could have been the story of this app if the hospital administration only used the traditional evaluation method, which primarily looks at cost versus benefit. Decision makers depend on available data when assessing whether the introduction of technology in the health sector is successful or not. It is therefore important to be able to present a bigger picture. That is exactly what happened when researchers at the Norwegian Centre for eHealth Research replaced the traditional evaluation with a detailed process evaluation. Qualitative assessments related to 7 different categories, taken from a widely used evaluation framework, were made. By focusing on these socio-technical prerequisites that affect an implementation, an overview of what is really happening is better captured. And thus, understanding the interaction between different parts of a process and how they affect each other is clearer. They conducted interviews to map the entire implementation process. They were in close dialogue with nurses, doctors, and the management at Norrlands sykehus. They also interviewed the supplier of the technology and the IT departments at the hospital and in the region. They discussed the findings with Norrlands sykehus along the way, so the research project and the implementation of the app became closely linked. With the help of this type of framework, one can understand why an implementation of the same technology can be successful in one department but failed in another. Complexities can also be revealed early on that can help influence the outcome of the process. In this project, the nurses did not save any time in their daily work as a result of the implementation. However, the evaluation revealed several other benefits. The nurses had updated patient information available right up to the patient's bedside. The workflow for the doctors was improved, and the managers at the bedside posts got a better overview of the patient's condition, as well as the distribution of work resources. An improvement was seen in communication regarding the patient's condition. An increased digital maturity was achieved around the use of and the possibilities that mobile devices provide. In other words, the implementation is far from a failure when you just look at it from a different perspective, and all parties involved describe it as a success. New technologies require new methods of evaluation. If large-scale digital change is to be achieved within the health services, this is one way research methods can contribute to promoting successful digitization processes.